I'd like to start the presentation here with just a number. It's kind of a number that seems big. If we're doing public health, maybe it's not so big. We chose to be a simple one, so it's a round number, 30,000. This number also happens to be roughly the number of people who die in motor vehicle accidents in the United States every year. We'll let that settle in for just a couple of more seconds.
How about another number? 95%. That's the percent of those auto accidents that are apparently due just to human error.
So think about those two numbers, and then think about if you drove. But don't stay in your car mind for a minute. Let's go into a time machine for about 100 years ago, when thousands of people were dying every year due to various infectious diseases for which we now have vaccines. That was a revolution then, and we now have an opportunity to think about revolutions for preventing motor vehicle deaths. We've made progress, but it's leveled off recently.
With the rise of things like distracted driving from our hyper-connected lives, progress on these issues can be a real challenge. In this century, we're on the cusp of another revolutionary advance in decreasing preventable deaths. We're talking about tens of thousands in the US and millions globally each year. And that revolution is self-driving cars.
Self-driving cars, automated vehicles, autonomous vehicles. You can call it what you like. But what it basically means is we take human error out of the equation and let you do what you were going to be doing in the car anyway. Think about that. Car manufacturers, technology companies, even governments are working right now to bring these technologies to market in years, not decades. And as we speak, Google has its own fleet driving around in California and Texas, and Tesla allowed a download of technology into its vehicles that allows them to drive themselves.
So it's clear that self-driving cars could transform the way we live. If we decouple local transportation from the ability to drive, it could change who gets around, how our streets look, how our cities are planned, and how our government budgets are structured. But how might it transform our health? Well, for those ages 5 to 34, auto crashes are the leading cause of death. That's really sad, and like you said, it's preventable. Now that I'm a little bit older, I think about how crazy it is that at the tender age of 16, I was allowed to operate a vehicle around other people.
Really? Why do we do that? But it's not just young people that make errors and commit mistakes while they're driving around. It's something that we accept because we get the benefit of being able to drive around relatively independently and quickly compared to other options for travel. But unlike the contagious diseases of 100 years ago, while we see this benefit, we also know from the Center for Disease Control that about 99 billion, that's with a B, dollars are lost each year to lost work, medical bills, and other related costs from motor vehicle crashes. Now, like I said, we've got these cars being tested in Palo Alto, even Austin, Texas, and Germany. They do get into crashes sometimes, but so far it's only been when there's been a human driver.
There are other ways that self-driving cars could transform our health and make the picture even more rosy. Pollution, smog, congestion in our increasingly urban societies are important issues right now. Self-driving cars could be built to be the most efficient vehicle we've ever encountered. They could be programmed to use fuel more evenly by accelerating and braking more smoothly than a human would. They could be built smaller and lighter without things like a steering wheel. They could also cut down on taxi drivers looking for passengers and drivers looking for parking. On a large scale, all these changes could make a real difference.
But there's more. Right now, there are people who can't drive and have to rely on friends or family or just not make a trip because they have the inability to get where they need to go. Imagine that we could actually reintegrate grandma and grandpa back into the lives that we otherwise are enjoying because they have the independence that we also enjoy. Now, we also know that being able to age in your home and in place is very important for maintaining and improving one's well-being versus going into a nursing home. Self-driving cars can contribute to that independence.
So how can we make sure this becomes a reality? We don't just want self-driving cars to be an option for the select few. Now's the time for us to review our laws about driving, about safety, about equity, and transform how we view those laws so that self-driving cars can be part of our next health revolution.
Thank you.